Two local community hospitals here on the South Shore, Quincy Medical Center and Brockton Signature, have faced multi-million-dollar budget gap because of cuts to Medicaid reimbursement rates. Now, it's a problem here in the South Shore. It's a problem across the state at healthcare facilities that cater predominantly to elderly or low-income patients. What do you think the state can do to help out community hospitals that so many people in the city and towns they serve rely on?
Representative Luskoko.
I mean, this is a huge problem, and the community hospital system, it's a travesty where we are now. As I said before, we're spending 30% of our state operating budget every year on Medicaid and on what we're doing, and yet the community hospitals are suffering. As far as how this system is going, a lot of what we've done is we've not addressed the cost side of the ledger. We have spent about $4 billion in both precious state money as well as federal money since the universal coverage has been into place, and yet we haven't addressed costs. There are unhealthy relationships between the insurance companies and the insurance providers that are artificially driving up the costs. Instead of making it easier for hospitals to expand and go, we have one of the toughest systems in the country for certificates of need. We make it hard for doctors and nurses to come in. If you're taking money and you're going to be subsidized, which now more than 20% of the people in Massachusetts are on subsidized health care. The wealthy people don't need it, and the poor people are fully taken advantage of. It's the middle class that has the difficulty, and if you can't come in and work and use the community hospital system to benefit everyone, it really hurts us all as a whole. But it's unsustainable in terms of how the cost structure is going to be. And if you're taking subsidized health care, we really should make it so that not everyone is on the Cadillac plan. It's unconscionable what is happening right now to the community health system in Massachusetts, and it is really the normal people that are out there, the average people that are playing by the rules, are really losing significantly, and we're going to be really sorry in a few years when we find those hospitals go away.
Governor Murray.
Well, I think it's important to continue to fund, and hopefully as better days come, grow the funding support of the Community Provider Trust Fund. It provides funding for many of those hospitals in urban areas where lion's share or disproportionate share of people are on Medicaid. But the other thing is trying to wring out savings, and the governor and I have put several proposals on the table and continue to push them, talking about changing from a fee-for-service where the doctors and providers and the health insurance companies just kind of charge for services to looking at something that sets a set allocation and encourages providers and others to use that in a more proactive way in promoting wellness, so you're not paying people at the other end. The other issue is taking on some of the health insurance companies as well. And you know, one of the things you talk about, job killer, you talk to small businesses, probably the biggest job killer is health insurance rates. Mr. Baker at Harvard Pilgrim raised health insurance premiums 150%. That's a job killer. That rate of increase, that's about $3,000 a year per small business or a family. So we've taken on the health insurance companies and said we're going to try to cap your rates. And some people, Charlie Baker and Tim Cahill, have called that a radical notion. But listen, we don't let utility companies unilaterally raise rates every year. We don't let auto insurance unilaterally raise rates every year. And I don't think we should let health insurance companies go off carte blanche either, because we know what happens. What happens is what we've seen over the years. They just hit cities and towns, businesses with double-digit increases year in and year out, and that's probably the biggest job killer there is.
Governor Murray, you got a reaction from both of the gentlemen to your right when you mentioned health insurance. Mr. Purcell, then Senator Tsay.
Dr. Jill Stein, Richard Purcell, 18 years at Bay State Health System. Single-payer health care. 3 words. You want to solve the health care issues and the cost of health care? 3 words. Follow the money. Single-payer health care system eliminates all the health care plans and puts it all into one payer system. You don't have 15 different Blue Crosses. You don't have 15 different Harvard Pilgrims. You don't have 4 Health New England plans. All those plans are eliminated and put into one health plan.
Is that the federal government?
This is Massachusetts. We're going to set an example for the rest of the nation by starting a single-payer health care system. The rest of the nation will look at the example that Massachusetts sets, and that's the precedent we want to set. Not only does it knock out the insurance company executives and administrators, that's where your money's going. Follow the money. The pharmaceutical company charges are so out of whack in this country. But in Massachusetts, if we start a single-payer system, that'll change.
Thank you. Senator Tassay.
The Lieutenant Governor and I have a different philosophy when it comes to private insurance. You know, anybody who didn't like Harvard Pilgrim or who thought they were being gouged by Harvard Pilgrim didn't have to buy Harvard Pilgrim. But yet people did. Here in your governor's own campaign committee uses Harvard Pilgrim because people bought it because the product was considered the best.
But the third fact you've had wrong tonight, Richard.
They've been ranked #1 in customer satisfaction of any HMO in the country for 5 years in a row. The difference, I guess, is, you know, when you increase taxes, the people in Methuen and Haverhill and businesses around, they don't have a choice. They can't go anywhere. And as a result of some of those policies, you know, we've seen incredible job loss. But again, the government, you know, when the government mandates something on you, you don't have a choice. The problem is with healthcare, it isn't Harvard Pilgrim, it's all of the healthcare companies. And the governor basically didn't do anything for 3 years.
What did your guy do for 10 years? He was the head of Harvard Pilgrim for 10 years. He had a chance to lead by example. He didn't.
The governor runs...
For 10 years, Richard. 10 years he was head of Harvard Pilgrim. Why didn't he lead by example?
Lieutenant Governor, you run the healthcare system, you and the governor.
Richard, you've been there for 25 years at the State House, Richard.
You're in the Senate President
You're
in the Senate President who's a Democrat, who's been the leader in trying to identify what the cost drivers are. The reason why rates are going up is because we have a system that nobody can identify, and it's not easy to figure out what are the things that are driving premiums up. And we've tried to have to study it, to identify them, to act on them. And we've let 3.5 valuable years go by.
What happened to the 25 years? You were there for
I'm going to interrupt for 1 second. Governor Murray, then...
You act like you're a disinterested observer. You've been at the State House for 25 years. With Republican governors. So don't act like you're just new on the scene, Richard.
But
you're not being straight with the people, and my question was, what did Charlie Baker do for 10 years? You want to try to put it all on us for 3.
Again, Charlie Baker was running a private healthcare organization. He wasn't in charge of the government, and the rates that went up at Harvard Pilgrim went up at every single healthcare provider.
Richard,
Representative Muskoka, you have the answer.
This is a good example. We've got two sides. Now, on the insurance side of the issue, healthcare reform in 2006, now all the health insurance companies have a captive audience. Everyone has to buy insurance, and you know what? It doesn't really matter what it costs. Everyone has to buy the insurance. They just do fine. The premiums go up. Sure, we want to reform things. Premiums go up. They all get paid. On the side of the government and the cost, without addressing the cost structure of it, the Patrick administration, I mean, in the connector with how it was done, this is a job killer for small businesses. We have the highest insurance premiums around the country, and yet they're built into the law. As a member of the legislature, we put a 6-month speed bump in there that somebody, before they could get into the connector system, had to wait 6 months, had to try and get insurance in the private sector for 6 months. What has happened at the connector right now, all through the last 4 years, is they're actually encouraging people to get on the subsidized care. Don't pay over here and pay these higher premiums. Come over here and get the government handout. It's not a coincidence that the cost has gone up 40%, and where it's coming from is higher education, the other money that's being spent. It's gone up 40%. It's 30% of our budget now. Not sustainable.